Menstrual cycle and hormonal regulation. What's happening in this 28-day cycle? What's bleeding? Which hormones are going up and down? Follicles and ovulation? All of this will be discussed in this lesson, and you'll know it forever. What's a period? Actually, it's really simple as this. Uterus wants baby. Girl doesn't have baby. Uterus wants revenge. We can't do these videos without you. If you hit the subscribe button, we'll make sure to do a lot more of these helpful lessons. To begin, we have to look into the base of our brain, specifically right below the hypothalamus, which is the pituitary gland. It's made up of the anterior and posterior pituitary. And in this lesson, our focus is on the anterior pituitary. Let's zoom in. Hypothalamus regulates hormones released by the anterior pituitary through the blood. For our case in the menstrual cycle, we begin with the hypothalamus producing a hormone called gonadotropin-releasing hormone, GnRH. This hormone travels to the anterior pituitary and causes the gonadotrophs, which are cells in the anterior pituitary, to make and secrete two important hormones known as follicle stimulating hormone, FSH, and luteinizing hormone, LH. In men, these hormones are seen acting in the testes, with testosterone release, spermatogenesis, and the development and maintenance of the male secondary sex characteristics. Our concern for this lesson is the female body. Here we'll see the hormones acting on the ovary, and especially the release of estrogen and its role. Let's take a look at what these hormones will do. These hormones will travel to the female ovaries where eggs are produced. If you forgot the basic anatomy of the uterus, let's do a quick recap. Here's the uterine cavity, the fundus of the uterus, the body of the uterus, internal orifice, cervical canal, external orifice, the cervix, vagina, ovarian ligaments, the uterine tubes, aka fallopian tubes, and here the main stage of our lesson today, the ovary. Let's draw a bigger image of the ovary and zoom in. Here at the top is our hypothalamus and the pituitary gland. Now we said from the hypothalamus to the anterior pituitary, the hormones are traveling through blood vessels. We have GnRH at the hypothalamus and the FSH and LH release from the anterior pituitary. And same here in the ovary, these capillaries we'll draw are what's bringing these hormones here. In the ovary, there are a lot of follicles, and every month some of these follicles will begin to mature, but only one will ovulate and produce an egg. So it's the beginning of the menstrual cycle, and she just shed her uterine wall, had her period. There's lots of these primordial follicles, and every month only some may mature into what we call a primary follicle. These are the beginning days of the menstrual cycle. Now, right when we begin the cycle, we'll tap in to see what hormone changes look like. On the y-axis, we'll show the changes of the hormone concentration in the blood. And the x-axis will represent the duration of the menstrual cycle, which on average is about 28 days, and will represent halfway at about 14 days with a dashed line. Now let's organize these 14 days into two phases. First 14 days of the menstrual cycle is known as the follicular phase, from 0 to 14 days. And the second phase is the luteal phase, from 14 to 28 days. In the beginning of the menstrual cycle, there is an increase in gonadotropin-releasing hormone, secreted by the hypothalamus. So when this occurs, as we said, we shall see a steady increase in both LH and FSH via the anterior pituitary. But actually we see something odd. FSH has a slight increase, but then tapers to a steady release. And LH has a steady release. Now this doesn't make sense, right? Why isn't it shooting up? We'll talk about it in a sec. In the ovary, FSH comes in, and this is the follicular phase after all, right? And like we said on the graph, follicle stimulating hormone initially rises. This is when FSH stimulates follicle maturation of the primary follicles. Some of the primary follicles will mature into a secondary follicle. Now, while these follicles are maturing, they produce another hormone we'll introduce, and this is estrogen. Estrogen does a lot of things, and especially in the first 10 days of the cycle. Estrogen causes this negative feedback on the pituitary gland, inhibiting the release of luteinizing hormone. So in low concentrations, estrogen inhibits LH secretion. Yes, that's why we see the steady LH hormone level in the blood. And yes, GnRH is stimulating release of LH, but because estrogen is at play, at low concentrations, estrogen inhibits LH release. A fact that you should know is FSH is secreted primarily in response to low estrogen concentration levels. So when estrogen levels rise, FSH levels will drop. And that's why in our graph we had a quick little rise of FSH, but when estrogen came into play from the ovary, FSH quickly came down. So now you know when a follicle matures, it produces more estrogen, which decreases the FSH and LH. In the ovaries, we have hormones at play, so we'll graph them as well in a 28-day cycle. Let's graph here estrogen, and this is a big player in the menstrual cycle. Estrogen is the male equivalent of testosterone, and does a whole lot of things. The effects of estrogen include it's an important regulator of folliculogenesis, especially after the antral stage. Estrogen is produced by the developing follicles, right? In the brain, it helps to maintain body temperature. In the breast, it prepares the glands for future milk production. In the bones, it helps to preserve bone density. The liver, it helps regulate the production of cholesterol, which in turn helps decrease the buildup of plaque in the coronary arteries of our heart. In our case, we know estrogen stimulates the maturation of the ovaries and the maturation of the uterus itself. So in the first 10 days of the menstrual cycle, the follicle is maturing. We see a steady increase in estrogen, a steady low concentration of LH because of the inhibitory effects of estrogen, and we also see a steady drop of FSH due to the increase in estrogen levels, which has a negative feedback. This is what's happening in the first 10 days. After 10 days, estrogen levels will continue to rise as the follicle matures, and will now create a positive feedback. It will stimulate the release of LH. So remember, at low concentrations of estrogen, there are inhibitory effects on LH, but at high concentrations of estrogen, it stimulates the release of LH. Now, after 10 days, things are a bit different. An increase in GnRH from our hypothalamus and an increase of estrogen from our ovary is increasing and stimulating the release of LH. We will now see a massive spike in luteinizing hormone concentration. This massive surge of LH triggers ovulation. It's picking the most mature follicle in the ovary, and this ovulation of the follicle will release the oocyte, aka the female egg. Now, after ovulation, the LH levels will drop back down. The gonadotropin-releasing hormone levels will drop down, and the FSH, after its small spike, will also come down. So now you know the LH surge causes ovulation and oocyte release. The follicle has now ovulated, so after 14 days, it becomes a corpus luteum. It's dead. And that's why we call the first phase the follicular phase for maturation and growth, and the second phase is the luteal phase for the degradation of the follicle into the corpus luteum, is death. So corpus luteum degrades, but it also does some things we have to know. It secretes 3 different hormones. It secretes estrogen, inhibin, and progesterone. So in our hormone graph of the ovary, at ovulation we found an increase in estrogen levels for ovulation, and then it drops a bit. Inhibin was not in the picture, but after ovulation and the degradation of the follicle to the corpus luteum, it begins to rise. Progesterone levels were also low before ovulation, but in the luteal phase they rise up. So around 20 days of the menstrual cycle, progesterone and inhibin are increasing, and estrogen is still around because all 3 of these are being recreated by the corpus luteum. Now let's figure out what these 3 hormones are up to in the luteal phase. Inhibin has a negative feedback, affecting the concentration of FSH, inhibiting the release of FSH. Think about it rationally. Inhibin knows we are in the luteal phase, and we don't need to mature any follicles, as we talked about in the follicular phase. Progesterone, our second hormone released by the corpus luteum, is the BMOC. This guy does a lot. Progesterone has this negative feedback on the hypothalamus, inhibiting the release of gonadotropin-releasing hormone. After ovulation and during the luteal phase, the progesterone levels are increasing and estrogen levels are sort of decreasing. Both these factors will suppress the release of GnRH. Because of this phenomena, you should expect there is a decrease in FSH and LH by the anterior pituitary. So it's straightforward from here. Progesterone and inhibin increase, causing a decrease in GnRH, LH, and FSH. Now progesterone does a whole lot, and its hallmark function is to stimulate endometrial growth. Remember, endometrial lining is the lining of the uterus which sheds each month during the period. Or we should also state the endometrial lining is where the egg will implant if it's fertilized by sperm. In this lesson, there's no fertilization happening, so the corpus luteum completely degenerates, and this is to allow for a new set of follicles to mature and enter the follicular phase. Corpus luteum here is gone, so those 3 hormones, inhibin, progesterone, and estrogen, all go down and decrease. If progesterone is decreased, then you already know there's nothing inhibiting the release of gonadotropin-releasing hormone from the hypothalamus. So GnRH will increase, and boom, we're in a new cycle. And hello, progesterone and estrogen can't really maintain the endometrial lining in the uterus now. So the endometrium naturally sheds, and this is the bleeding during the period. The new cycle has begun. Here, pause on this diagram to see the hormone levels, ovarian cycle, and the endometrium layer in one shot. Okay, now you're in good shape to answer these questions. 1. In a normal 28-day menstrual cycle, when would you expect the LH surge to occur? A, B, C, or D? And 2. Which one of the following is the primary source of progesterone in the later stages of pregnancy? Is it A, B, C, or D? Pause and think and drop your answers in the comments below. If you'd like to see more of this lesson, head over to our Instagram page and TikTok channel at rev.med. We'll have this lesson along with many other topics for you to study. By the way, don't forget to do questions. Are you learning something from our videos? Well then click the subscribe button to your right. We are releasing high-yield lessons and ways for you to get ahead in class. Be sure to follow us on Instagram to take interactive quizzes and view your favorite diagrams. Nothing can stop you, but only if you believe in yourself. You got this.